Africa, a continent of great beauty, substantial resources, and wonderful people, is currently devastated by the HIV/AIDS pandemic, which has created over 15 million orphans in sub-Saharan Africa. Sonrise Church in Surrey, British Columbia, is responding to this need by partnering with sister churches in Zimbabwe who are caring for hundreds of impoverished children. There are over 1 million orphans in Zimbabwe, and their plight is heightened by an economy collapsing with 5 years of famine and a corrupt government. ACOP of Zimbabwe is 120 churches under the leadership of Emmanuel and Betty Zahovi. They have a team of pastors and workers who are extending themselves to make a difference for this generation of orphans.
Because of the need in the country, we really don't know how many that will be, but we would like to take care of these youngsters who are left with no parents and things. We had been having like 5 years continuous drought in the country. We don't have food. When we have funds, when we receive funds from whoever donor helped us, we take a truck and we go down to South Africa and we bring food for the orphans, and we distribute that food into our 3 centers.
Many churches are building feeding centers on their property to increase their capacity to serve the impoverished. Sonrise responded to this challenge and, with the help of many friends, raised money to send a team to Zimbabwe in August 2007 to help build one such feeding center, to provide funds for food, medicines, and schooling, and to scout out the opportunity for ongoing help. We have determined to help resource the 3 centers of orphan care which we were able to visit at Rugare, Musana, and Kadoma. In Harare, the Rugare township has been particularly devastated by AIDS-related deaths. ACOP has had a church in Rugare since 1974, currently led by Pastor Henry, who has a big heart for hundreds of orphans.
This is a compound of about 10,000 people, formerly for National Railways of Rhodesia. Most of the people who were staying here were formerly from the SADC region, Malawi, Mozambique, who came here in Zimbabwe as labor migrants, and they were settled here. But later on, after they got their pension, they just left up the kids here in the house and went back to their home area, and the wife get married somewhere and left the kids. That's why you see them roaming around here. We have 410 orphans that we've discovered so far, but we are currently looking after 150 only because of some food and the money to take care of them, and the space as well. Among the 150 kids that we have 50 desperate ones. Those who totally depend on us here in terms of clothes, food, school fees, everything that a child needs. We have 25 trained caregivers whom we are working with here, and 1 secretary and a cook who is permanent, whom we have employed recently. And the caregivers would visit the homes and take care of the kids at their homes there, help them to bath them, take care of the health situation, and we give them food bags at home there. But they have their porridge in the morning here, 6 to 7 o'clock morning, and afternoon 1 o'clock to around 3 p.m. it's playtime and feeding time as well for their lunch, and then they go back to school. We serve them sada and porridge for sada and beans for lunch, and porridge in the morning.
The inadequate facilities in Rugare, along with its urban environment, which includes beer halls and clubs nearby, has caused ACOP of Zimbabwe to begin a new orphan care center in Musana, a rural area about 40 minutes outside of Harare. Their intention is to move older orphans to Musana when it is developed, allowing the Rugare Center to reach out to others in need. ACOP of Zimbabwe started a church in Musana in 2006. They purchased an acre of land beside a community building with a vision to establish a center for orphans called the Oasis of Hope.
It was our desire to help the rural people, and I must say this is the second project. There is one in Masvingo and this is the second one. But last year we built the other one in town, so we said it is better to benefit those that are in the rural areas. So that's why we managed to come and purchase this land so that many people surrounding this place will be helped.
If there is enough food for the orphans, I think that is the most important thing.
kids need food, clothing, medication especially. Because when they're healthy, it's good and fun.
They haven't got money for school fees and proper clothing.
This is the headman of this place, is Mr. Marembo. He's the one who is looking over us all over this area. And he's from Kahari. That's where
village.
He's from.
There's so many problems what we're facing here. We can't get the food just because of the fertilizer.
In the terms of education, I think to these orphans we've got serious need because a lot of them they are not going to school.
I interviewed the kids to find out whether they were true orphans or not. In my register and the number of the key orphans that I sent to the office in Canada, they are about 32. But now they're exceeding that number. I think they may reach even 50.
The vision for the Oasis of Hope property in Musana is to build 2 feeding centers, which will also serve as preschools, along with a church, a well, a medical clinic, and some dormitories. The Sonrise team helped to fund and build the first feeding center in August.
Lots of kids, they have lost their parents.
Some of them, they died of that pandemic, HIV/AIDS pandemic, which is everywhere in this world, usually in Africa.
Many kids, they're going to benefit, they're going to be fed, they're going to have maybe money for fees to make them that they may go to school. So it means a lot to us.
We were also able to visit a third center in Kadoma, a city about 140 kilometers from Harare. The leader of this center is Pastor Asman, who is the original visionary for ACOP Zimbabwe's orphan care ministry.
My vision for the orphan care started 1997. We are actually caring after 197 children, and out of 197 children, we have 20 caregivers, the people that has volunteered to come and support us and help us in the locations, in the community. So they visit these young people, see their problems, help them to clean themselves, and then we gather up food all the time. And every month, we take food and we distribute food to each child, 10 kg of mealie meal, 3 kgs of beans, that is sugar beans, and 675 meals of cooking oil. So we do that every end of the month. Now what we are doing with the children is, since their parents passed away, they don't have any land where they can till and feel the importance of building and working on their own. So we bring the children into our garden so that they can then work in the garden to try and see what they can do, try to build them from inside to outside. So they are the ones who are actually working in this garden, and they are so excited to see the produce of the garden. We are looking at the first 3 structures that probably by the end of November, those 3 structures will be complete. And we are expecting to be putting 16 young people that are already selected from the volunteers and myself, who are going to be staying there I'm expecting by the end of November. Just very close to the units, to the houses, we are going to build a feeding center. The reason is because we would want to have the other children whom we are going to take into the units to come when we are teaching them the Word of God. We need to cook for them first. Then after that, we start teaching them the Word of God. And we also do some games with them. We do what we call kids clubs with them. So we want that wheat feeding place as an open space to do those kid clubs. There is a big need, especially for exercise books and uniforms. Most of our children are going to school without shoes.
We are impressed with the resilience, the compassion, and the vision of our Zimbabwean friends in the face of their current trials. We want to invite you, our Canadian friends, to partner with us to resource and empower the Zimbabwean church to care for a generation of orphans. We can help save a generation in Zimbabwe if we act out of compassion to give hope to these friends in their time of distress. Your monthly donation of $32 will provide food and education for 1 orphan. Please become a partner today with the Sonrise Orphan Care Zimbabwe initiative.
I can't believe you saved me in the nick of time, just when I thought nobody cared. You reached out and with your hand took mine. You know just how to pull me through. That's what I love about you. You give me hope, and I can face another day. All it takes is love and faith, and the courage to believe. You give me hope, and there's nothing I can't do. I get all my strength from you, saying you will stand by me. You give me hope.
Imagine his future filled with hope.